Hello and welcome. My name is Chris Rowena, and I'm the lead communications analyst at HCAI Workforce Development. We're thrilled to have you join us today for the Certified Wellness Coach Fee Schedule webinar. Here's today's agenda. We're going to go through an overview of the CYBHI fee schedule program, an overview of the Certified Wellness Coach's profession, talk through Certified Wellness Coach services, we'll talk through supervision and medical necessity. Then we'll talk about operationalization in different settings, followed by some Q&A. A little housekeeping before we get started. Number one, this webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the chat and the view controls in the menu bar at the top of your screens. The chat option will be open for asking questions during the Q&A, which is at the end of this webinar. This webinar will be recorded and will be available within 7 to 10 business days on our website. And with that, it's my pleasure to introduce Corinne Marshallek from DHCS, who will get us started.
Hi, everyone. I'm Corinne Marshallek, Health Program Specialist in the School-Based Services branch at DHCS. In our first section, we will provide a brief overview of the Children and Youth Behavioral Health Initiative, or CYBHI, fee schedule program. This primer is going to cover the CYBHI fee schedule program statute, the goals of the program, conditions of participation for local education agencies or LEAs and public institutions for higher education or IHEs, their eligible insurance types under the CYBHI fee schedule, and discussing student health insurance data collection all throughout this section. You already moved to the next slide, so I'll start here. All right. Digging into the CYBHI fee schedule program statute, California Welfare and Institutions Code, section 5961.4. Through the statute, the state has developed a formula for success consisting of 3 main ingredients that you see here. The school-length statewide fee schedule for outpatient mental health services and substance use disorder treatment provided to students 25 years of age or younger at a school site, a school-linked statewide provider network of school site behavioral health counselors, and lastly, the policy stating that the providers of medically necessary school site services described in this section shall be reimbursed at minimum at the fee schedule rate, regardless of the network provider status. Next slide, please. Thank you. Now that we've discussed the statute that began this all, that has laid the foundation of the CYBHI fee schedule program, let's review the program goals by establishing a sustainable funding mechanism for school-linked behavioral health services, the CYBHI fee schedule program. It increases access to the school-linked behavioral health services for children and youth. It applies to multiple managed care plans or MCPs and insurers, easing the uncertainty around students' coverage. It expands the types of practitioners eligible for reimbursement for school-based behavioral health services. It creates a more approachable reimbursement model for schools, shifting to fee-for-service reimbursement. It eases the burdens around contracting, rate negotiation, and navigation of delivery systems, with state established rates for all included services. And lastly, the CYBHI fee schedule program supports managed care plans or MCPs and insurers interacting with the LEAs and IHEs with a third-party administrator to manage the provider network, facilitate claims administration and payment remittance, and basically lessen the burden on the LEAs and IHEs. Next slide, please. Thank you. Next, we want to highlight insurance types eligible and obligated to reimburse for services rendered under the CYBHI fee schedule program. So what the fee schedule program actually does is require the medical delivery system, like Medi-Cal managed care plans and Medi-Cal fee-for-service, as well as healthcare service plans or commercial plans and disability insurers, to pay for behavioral health services specifically that are being delivered by the LEAs and IHEs and their designated providers and practitioners in their school site settings. That is, to be eligible in the program, a student must be covered under one of the 4 insurance types that you see there on your left that I just mentioned, and must be under the age of 26. For individuals not covered by managed care plans, healthcare service plans, and insurers included in the CYBHI fee schedule, schools are still expected to provide medically necessary behavioral health services. Alternate funding sources may be available. On the right of this slide, you can view a list of excluded insurance types not eligible for the CYBHI fee schedule program reimbursement, such as school education plans like IEPs or 504 plans, federal plans or self-funded insurance plans, the SIM-NSA health plans, high deductible health plans, and Medi-Cal share of cost plans if the deductible has not been met. Next slide, please. Thank you, thank you. Next, let's briefly discuss the student health insurance data collection. LEAs and IHEs and certain designated providers serving students will need to collect and transmit student health insurance information for eligible students in the CYBHI fee schedule program. To lessen that burden, LEAs and IHEs should establish systems and strategies to proactively collect student health insurance information from eligible students and or at the point of service. DHS is committed to ensuring that only the minimum necessary student health insurance data is required to be reported, but it may include the items listed here: the student's first and last names, the student's date of birth, health insurance plan name, member subscriber name, and the insurance member ID and group number. Please note that LEAs and IHEs must ensure student health insurance data is up to date each time the service is billed under the CYBHI fee schedule program. It is also important to remember that LEAs and IHEs are not required to collect student health insurance information for all students enrolled in the district or campus. This is only for students with whom are seeking reimbursement services as part of the CYBHI program. Next slide, please. Thank you. Here we have provided a real-life example of LEAs participating in the cohort 1 of the CYBHI fee schedule program and the system that they put in place to collect student health insurance data. This LEA collected health insurance data from students in various areas throughout the school year. They collected it at the point of service that's deemed necessary, at the beginning of the year, directly through their student information system, through a healthcare coverage and enrollment form, which asks if the student health insurance and if the parent and guardian would like to be contacted regarding Medi-Cal coverage during an annual registration enrollment as an optional question, and then during sports field trips and on enrollment forms. All right, so those are just some examples of what some of our LEAs in cohort 1 actually did and to collect that student health insurance data. We have concluded this section, and now I'm going to hand it off to our Ben Gamache at HCAI.
Hello, everybody. Ben Gamache, policy consultant with Health Workforce Development in HCAI. And I'm going to be giving you an overview of the Certified Wellness Coach profession. Next slide, please. So just as a quick reminder of grounding, I'm sure most of you have been tracking and or following the wellness coach profession for some time now, but as a good reminder, this role was designed to increase overall capacity for children's behavioral health and serve vulnerable populations of children and youth where they are. So that's why a big focus it has been on the school setting, and of course the Children and Youth Behavioral Health Initiative has many different projects that are associated with our school systems and our school-linked organizations. So that, of course, is what we're going to continue to be focusing on today. Also, I'm going to be taking some time to go through our certification requirements and how this is intended to fill in some of the workforce gaps that exist today, especially at those undergraduate levels. So if you can go to the next slide, please. Just a quick illustrative example. Again, this is not meant to be exhaustive of all the behavioral health professions out there, but just a good reminder that the Certified Wellness Coach does exist within the Associate's level for Certified Wellness Coach 1 or the Bachelor's level for Certified Wellness Coach 2. If you go to the next slide. This has been just a reminder for what our certification requirements are as well. So we have two pathways to certification, depending on either competencies gained from a degree within education or competencies gained from work experience in the field. So our education pathway does right now accept a smaller list of majors, those listed here in social work, human services, addiction studies, and psychology. All of these, of course, with a behavioral health focus, and then the minimum hours listed below. So individuals must get either an associate or bachelor's degree in one of those fields, and then meet those minimum hour requirements, providing experience in direct preclinical behavioral health services to clients in schooling, school-based organizations, nonprofits, community organizations, and or health center clinics. This must be recent as well. So these are folks that are recently graduated or have just graduated. And any hours that they don't get as part of the degree program, they can go afterwards in internships or gain via internships, volunteer, or work experience. And hours from our Wellness Coach 1 certification also apply towards the total of a Wellness Coach 2 certification. So that is our education pathway. And then our workforce pathway on the next slide is for those that have already been doing this work. We know that the Wellness Coach scope of services has existed, and many schools have been offering this with things like family and youth liaisons, for example. So this is an opportunity to support those folks in getting a certification and ideally offer some retention and sustainability components for employers by getting these folks certified and being able to take advantage of Medi-Cal billing. And so this is more focusing on the competencies gained from that experience. So while this does expand to any degree, again, we want this to be a stepping stone to advanced professions and making sure that folks have an opportunity to have that baseline degree. We really are focusing more on the competencies gained from the experience. So you can see that there's 1,350 hours of experience for the Wellness Coach 1, which is roughly equivalent to 1 year of full time in an education setting. And then 2 years within Wellness Coach 2 at 2,700 hours. And again, this must be providing direct preclinical behavioral health services to children and youth in those qualified settings. And as a reminder, wellness coaches cannot operate independently, and they must operate under appropriate supervision, which is a PPSC credential holder or licensed clinician within a school setting or a licensed clinician outside of a school setting. And we'll touch upon that a little bit later about some of the distinctions between a wellness coach supervision versus an ORP that DHCS will discuss a little bit later. So if you can go to the next slide. A reminder that HCAI is the certifying entity, so we have our website and some resources listed here where folks can go to get certified. We also have a CWC status search tool available, so you can check on the status of an individual's certification. You do need their legal first name, last name, and certification ID, but this is really intended for our employers to keep track of the certification status and make sure that they are in good standing. And then, of course, we have some certification support tools as well, such as a walkthrough, et cetera. And so all of this was really intended to remind our employers that in order to take advantage of fee schedule and the billing of wellness coach services, wellness coach certification must be active and it must be in good standing. Wellness coaches are also required to recertify every 2 years. So we have more information on that page linked here. And we've done a previous webinar as well on that, so there's lots more information. But again, this is just a reminder for our coaches and our employers to ensure that that certification does remain active, because that is what qualifies them to be able to offer wellness coach services and get reimbursed via Medi-Cal and commercial insurance via the fee schedule program. Next slide. So now that we understand certification, how to become a wellness coach, just a quick review of the services that a wellness coach offers, and then that'll really help lead us into the subsequent sections by DHCS that show how these services translate to the fee schedule codes and can be billed for reimbursement, because there's definitely some distinction in the language of our model, how it's listed in the state plan amendment, and then how it's reflected in the fee schedule T codes. So just a quick reminder here, and I'll go into these in a little bit more detail, that these 6 core services listed above are the scope of services for our wellness coach. And if you can go to the next slide. We also see this reflected in the state plan amendment, also known as a SPA 25-0014. There's a link to that SPA down below as well. And also there's more information on the DHCS CYBHI fee schedule program page as well. But just as a quick reminder that within the state plan amendment, certified wellness coaches are meant to operate as part of the care team to provide the following services: wellness promotion education, screening that does not require a licensed provider, or if there are more qualified screenings, they must be under the direction and administration of a qualified provider, care coordination, which includes navigation services, individual and group behavioral health supports that can include wellness education, coping skills, goal setting and planning, some of those other things you see listed there. Crisis referral. Again, they are not meant to do crisis de-escalation, but instead to understand and identify potential risk and then provide emotional support and warm handoffs to licensed providers or other qualified behavioral health providers that are equipped to handle those more serious needs. And then what wellness coaches, just as a reminder, are not meant to do are assess, diagnose, or provide clinical intervention or treatment, or provide clinical referrals. So if you go to the next slide, I have a few more examples as well about wellness coach, examples of appropriate in-scope wellness coach practices and then out-of-scope practices. So as I mentioned, we're really in that preclinical prevention, early intervention space. So in the behavioral health related support, they're going to be offering those preclinical services. What they're not going to be doing that I just mentioned are screening for or diagnosing students or providing treatment. Also to ensure that while they do intersect and interact with teachers, with academic counselors, et cetera, they are not providing academic advising services. They are not creating system or specialized curricula or facilitating system level programming. While they definitely coordinate and assist with screening tools and documentation, again, they are not meant to administer state or interim assessments. They are not meant to develop and administer master schedules or academic advising appointments or anything related to student enrollment. And they're also not meant to administer and coordinate individual IEPs. So just as a quick distinction too, they are meant to collaborate with teachers. They're meant to collaborate and operate under the direction of the school counselor, school psychologist, school social worker, school nurses, in collaboration with, but they are not meant to be doing anything that our health teachers would be doing, for example, or that our credentialed individuals or licensed clinicians will be doing. So just ensuring that we continue to understand the appropriate scope of our wellness coach. Next slide. And now I'm going to pass it over. Now that we understand about the model and the state plan amendment, we're going to start talking more about the actual services of a wellness coach and how that relates to the fee schedule program. So I will pass it back to Corinne.
Hi again, everyone. In this section that we are about to go into, we are going to cover certified wellness coach services like procedure codes, rates, service code utilization, service limits, and documentation requirements. Next slide, please. Thank you. Certified wellness coaches have 3 distinct service codes for health and well-being coaching available for billing, each representing a different type of service. As you see here, code 0591T is for individual initial assessment conducted face-to-face or telehealth for at least 30 minutes. This service is reimbursed at $66.24. Code the second one is 0592T, and that covers the follow-up sessions for individuals, also face-to-face, and at least 30 minutes of service. This service is reimbursed for $41.08. And then the final code is code 0593T, which is for group sessions. This includes 2 or more individuals, again, face-to-face, at least 30 minutes. This service is reimbursed at $12.45 per participant. These 3 certified wellness coach services can be billed retroactively to January 1st, 2025. And we're going to go a little bit more in depth on the service utilization on the next slide. Next slide, please. Perfect. Thank you. Here on this slide, we're going to explore further that utilization and frequency limits of the Certified Wellness Coach service codes I just mentioned. The Certified Wellness Coach, or CWCs, sorry, the CWC service codes within the CYBHI fee schedule have service limitations, or otherwise known as limits, placed on specific procedures or behavioral health services. So for example, code 0591T, that first code that was shown, is the individual initial assessments, like I mentioned, that cannot be billed on the same day as a follow-up session for either an individual or a group session. So they cannot be billed together, the initial assessment and the other two codes. So 0591T will be the first. So basically 0591T will be the first time the certified wellness coach meets the student. And then 0592T, for example, may be the next day or days following, and the services for every follow-up individual session. You're going to use that billing with that student after the initial assessment is done. And then the group session 05913T does not have a limit in size. And then additional notes on these codes regarding the service. CWCs can provide services to a parent or caregiver. However, that service needs to be with the benefit for the benefit of the child and with the child present if you're going to do that. And then we're going to move on to the next part there of the frequency limitations. Can you go back to the last slide, please? Thank you. So the second portion, the frequency limitations, the initial assessment code has a max of 2 units per year per provider. And then both the other two codes, the follow-up and the group sessions codes, have a max of 3 units per day per provider. In order for a service to be eligible, the service must have lasted at least half plus 1 minute of the billing increment specified for that code. What we call is, and you don't see it on this slide, is the midpoint rule. It is a minimum for all time-based codes. A minimum of 16 minutes of service must be provided to bill for one 30-minute unit. So for example, codes can be billed at a midpoint of 30 minutes. So that's 15, which is the midpoint of 30, plus 1, which equals 16 minutes, and 16 minutes equals 1 unit. Time billed for reimbursable behavioral health services should include only direct service time, which should be documented in the medical or student record to identify that time spent with the individual receiving services. Additional notes that we wanted to share here: indirect service time has been included in the reimbursement rate and should not be billed. And CWCs can provide, I already mentioned, I'm sorry, CWCs can provide those services to the parent or caregiver that I mentioned earlier, but the student has to be present and it has to be the benefit of that student. Next slide now, thank you. Okay, on this one, the service documentation requirements, we ask this question quite frequently. We are asked this question quite frequently. What are the service documentation requirements? CYBHI providers should document services in alignment with clinical practice standards for that profession. For example, the provider should determine if it is appropriate and necessary to develop a problem list or a treatment plan based on the clinical practice standards of the needs of the student. At a minimum, as a condition of participation in the CYBHI fee schedule, LEAs and IHEs must comply with service documentation and availability of records requirements specified in Medi-Cal regulations, including the maintenance of records necessary to fully disclose the type and extent of services provided and listed here, such as billings, all health records, service delivery reports, and other prescribing treatment plans, copies of remittance invoices, advices, which accompany reimbursement to the providers for services furnished to the students. A good example of this would be the explanation of payments or payment summary voucher, and identification of the person directly providing services to the student. And for non-licensed practitioners like wellness coaches, certified wellness coaches, working under the direction of a licensed practitioner such as an LCSW. This includes the supervising licensed practitioner to the extent required by the applicable professional licensing statutes and regulations. And lastly, records of logs, appointment books, or similar documentation showing date and time allotted for the appointment for each individual or group and individuals and the actual time spent on that appointment. We would be remiss at DHCS if we didn't mention that LEAs and IHEs participating in the CYBHI fee schedule are not required to complete annual cost reports or participate in random moment in time surveys as it is required for other programs like Navy, LEA, BOP. We do not require those type of documentations. And now I will pass it over to my colleague Amar Takar to discuss the next section.
All right. Thanks, Kareen. Hi, everyone. My name is Amber Takar. I'm one of the unit chiefs over here at the Office of Strategic Partnerships, housed at the Department of Healthcare Services. Kareen, myself, and the rest of the team here, we're involved in the program administration of the CYBHI fee schedule. We do things like policy development, provide a lot of TA via webinars, email, and all that stuff, and plenty of other things regarding the program. I just want to first thank HCAI for letting us do a presentation here, talking about certified wellness coaches and then also the billing side of things as well. So thank you all for attending, and let's talk about supervision and medical necessity. Let's go to the next slide. Okay. So really quick, with regards to medical necessity criteria, I want to give our perspective from billing, CYBHI fee schedule, and billing and how that looks and what that means with regards to medical necessity. So under this program, providers and practitioners can be reimbursed by Medi-Cal managed care plans and commercial insurers for delivering outpatient mental health and substance use disorder services to students under the age of 26, as long as those services are provided at a school site and meet medical necessity criteria. These criteria are grounded in the Federal Mental Health Parity and Addiction Equity Act, very long acronym there, which ensures that mental health and substance use disorder services are covered on par with physical health services. Next slide, please. So when it comes to students covered by commercial healthcare service plans or disability insurers, the definition of medically necessary treatment for mental health and substance use disorders is clearly outlined in California law. According to California Health and Safety Code 1374.72A3A and Insurance Code 10144A3A, medically necessary treatment means a service or product that addresses the specific needs of the patient for the purpose of preventing, diagnosing, or treating an illness, injury, condition, or its symptoms, including minimizing the progression of that condition. So the condition must meet key criteria. It must align with generally accepted standards of mental health and substance use disorder care. It also must be clinically appropriate in terms of type, frequency, extent, site, and duration. Let's go to the next slide. All right, so additional guidance. So under this definition, a service is considered medically necessary if it is needed to correct or ameliorate a physical or mental illness, condition, or health defect that is identified through screening services. These include services that prevent a condition from worsening, prevent the development of additional health problems, or maintain or improve a child's current health status. Importantly, the determination of medical necessity must be made on a case-by-case basis, taking into account the individual needs of the child, and this all ensures care is personalized, developmentally appropriate, and responsive to the unique circumstances of each student. And then also, even if a service isn't typically covered under Medi-Cal for adults, it may still be covered under for youth under 21 if it meets this standard. And we'll go into that in the next slide a little bit more. Okay. For Medi-Cal beneficiaries aged 21 and older, a service is considered medically necessary when it meets the standard outlined in California Welfare Institutions Code 14184.402. Specifically, service is medically necessary if it's reasonable and necessary to protect life, to prevent significant illness or significant disability, or to alleviate severe pain. Right. Let's go to the next slide and talk about illustrative scenarios. So this is an example of how a school-based mental health services can be both clinically appropriate and reimbursable under the fee schedule. In this scenario, a general education high school student is experiencing increased anxiety related to college admissions. They report difficulty sleeping, loss of appetite, and feeling overwhelmed. So during the 45-minute session, the PPS Credential School counselor meets with the student. The counselor administers a clinically validated anxiety screening tool, which is built under procedure code 96127, and assess the student's needs and provides evidence-based strategies to manage anxiety, built under procedure code 99403, documents a session in the student record. And this session is an example of a medically necessary school-based mental health service that is eligible for reimbursement. All right, let's go to the next slide here. Okay, shifting gears a little bit, we're going to go into how supervision looks like when we're talking about the fee schedule and how that's reflected when you're claiming for reimbursement. So in the fee schedule, all services must be recommended by a physician or other licensed practitioner of the healing arts as defined in Federal Regulation 42 CFR 440.130D. This regulation defines a licensed practitioner of the healing arts as someone who is authorized under state law to provide medical or remedial services and acting within their scope of professional practice. Here's a list of examples. We got physicians, nurses, psychologists, clinical social workers, and other licensed practitioners, professionals, depending on state licensure laws. All right, let's go to the next slide here. Okay, let's talk about ORP. What's a ORP? It's a provider who is ordering, referring, and prescribing. It's going to be a licensed practitioner who is authorized to order, refer, prescribe services for Medi-Cal beneficiaries, but cannot bill Medi-Cal independently for those services. So under the fee schedule program, ORP providers are required on claims for Medi-Cal covered students only. This ensures that all services are properly authorized by a qualified professional, aligning with Medi-Cal. A few points to consider. There's no limit to the number of referrals an ORP provider can make. And then also, ORP providers do not need to supervise the rendering provider. And then also, just keep in mind, licensed clinicians can enroll for free as ORP providers through the DHS provider enrollment website. If you need that website, let us know. All right, let's go to the next slide. Okay, so more into what it looks like for certified wellness coaches and ORPs. When submitting a claim, the ORP name for that certified wellness coach needs to be on the claim and also their NPI because they are under the unlicensed practitioner category there. And also, this is a great reference if you have any questions about other practitioners and ORP requirements for them too. All right, let's go to the next section here. Okay, so I'm going to be going over some examples of how billing looks like for wellness coaches and when they're providing services. So let's talk about all of those. Okay, so here's a couple of examples. We kind of flow from left to right when reading this. So in that first example, this case study shows that we have a school-employed certified wellness coach teaching life skills and stress management to a class of 30 students for 40 minutes. This is billed under code 0593T, which is group coaching, with 1 unit per insured student. And then in the second example, we have a CWC from a community-based organization that delivered a 30-minute presentation on coping skills at an after-hours school program. Again, this qualifies for the same code with 1 unit per insured student. Next slide, there we go. Okay, so screening is another key service area. In the first case study, we have a CWC who's facilitating a SAMHSA aligned, apologize if I mispronounced that, aligned screening under PPS-C guidance. Each session lasts for 16 minutes. Qualifying code is 0591T and 1 unit per student on that one. In the second case study, we have a CWC administering an ACE questionnaire to multiple students, again, meeting the 16-minute minimum in this situation. I want to refer to what Corrine mentioned. Some of these examples are going to have like these half-point rule situations where it's 15 plus 1 minute. This is where those apply. So you'll see like an odd number like 16. That's because to bill for 1 unit in that case, you got to have meet the midpoint rule and then add a minute That's why you see 16 minutes, just to make sure we're clear on that. And then also, yeah, let's go to the next slide really quick. Okay, so now we're going to look at individual support here. In the first example, a certified wellness coach meets with a student for 45 minutes, then again for 20 minutes on a different day. The initial session qualifies for two units under 0591T, and then the follow-up for 1 unit under 0592T. In the example, the certified wellness coach checks in with the student twice in 1 day for a total of 20 minutes. This qualifies for 1 unit under 0592T. And also important note here, initial and follow-up sessions cannot be billed on the same day for these codes. All right, next slide. Group support. So group support services are billed under 0593T, like earlier. In this case, a certified wellness coach provides a 40-minute wellness session to 8 students. Each student counts as 1 unit in the situation. In the second case, the session is only 20 minutes. While it involves 3 students, it does not meet the 30-minute minimum, so it cannot be billed unless extended to at least 16 minutes. All right, let's go to the next slide. Crisis referrals. These services are also billable under these codes. In the first example, a CWC stays with a student experiencing suicidal ideation for 50 minutes until the crisis team arrives. This qualifies for 2 units under 0591T. In the second example, the CWC performs a warm handoff to a licensed provider after identifying a student escalating in need. If this interaction lasts at least 16 minutes, it qualifies for 1 unit. Anything under 16 minutes does not meet the billing threshold. All right, next slide, please. Care coordination. In this example, a CWC helps a Medi-Cal student and their family connect with CalFresh and follows up to confirm enrollment. The total time spent on this service is 60 minutes, which qualifies for 2 minutes under 0592T, follow-up sessions for individuals. So that is that example. Next slide, please. All right, and we're talking about telehealth as well here. So in this case, a CWC meets with the student via Zoom for 25 minutes on day 1 and 30 minutes the next day. So the first session qualifies as 1 unit under 0591T and the second for 1 unit under 0592T. Again, initial and follow-up sessions cannot be billed on the same day, even if they're delivered virtually. So something to keep in mind there. Right. Okay, so let's go into some examples that are not billable here. We have 3 case studies talking about this. So for the first one, a CWC meets with a student for an initial session lasting 46 minutes, then again for a 30-minute follow-up session, both on the same day, keyword. While both sessions meet the time requirements, you cannot bill both initial and follow-up session on the same day. And then for the second case study, a certified wellness coach spends 20 minutes meeting with the student's special education teacher and school counselor to discuss wraparound support. While this is a great coordination effort, it's not billable because a student was not present during the service itself. In the third case study, CWC assists a school psychologist with documentation and completing paperwork to submit claims for 5 students. That takes 40 minutes. The time is not billable because CWCs can only bill for direct service time, not for documentation or admin support. So a couple of things, couple of takeaways. I think when it comes to billing for CWC services, keep in mind time spent directly servicing the student is eligible for reimbursement, and also documentation or admin is not a billable service as well for CWCs. And I think that's my last slide. I'm going to hand it over to Christopher, who's going to be facilitating our Q&A. And that's it for me. Thank you all.
Thank you so much, Amar. As our teams diligently implement this important aspect of the certified wellness coach profession, these webinars are an important way for us to keep you informed and respond to your questions. We're now going to transition to our Q&A session. To ask a question, simply click the chat button in the menu bar and type your question. We'll do our best to address as many possible questions as we can in our time together today. If you do have questions about specific personal circumstances, please email our team so we can provide the most accurate information for you. And so let's jump on in. I see the questions coming in already. So first question we got, is it required to submit a claim for 0593T for a student before the others two billing codes can be used for that student, or is that optional?
Hi, this is Kenna from DHCS. So for a provider, when it's their first time seeing the student, they should be choosing the initial code of 0593T. Every time after that, they can choose, 0593T is group. So the initial code is 0591T. That should be selected first as the first time they see the student, and then subsequently it can be the follow-up or group. And specifically, I believe the question is about an individual. So if you're seeing an individual for the first time, it should be that individual initial. But if this person is being seen in a group, that's okay to just use the group code. They don't need an initial individual before they can attend a group. They can attend a group separate from any individual follow-ups with the wellness coach.
All right, thank you, Kenna. And that was a great question to get us started here today. Next question is, can we get a copy of this PowerPoint? Absolutely. We're going to be posting this PowerPoint and the recording of this webinar on our website. It will be up within 7 to 10 business days, and so keep your eye out for that. Next question, Nancy asks, how long is it taking for coaches to get certified? Dan, I think that question is for you. Yeah.
Yeah. It really depends. If they have their degree and the hours completed already, the certification process itself is pretty simple. The main requirements are getting unofficial transcripts and then also validation and verification of those field experience hours. We have a form that a supervisor must complete on behalf of the coach, and then the coach will upload that into their certification application. We do have a walkthrough deck linked in this slide. If you go back to the certification section that we have, there is actually a certification walkthrough that shows you A to Z, all the steps that are required. If you have all of those details pulled together, it shouldn't take probably more than 10 to 15 minutes. The certification application is meant to be pretty low barrier and pretty easy. But if the broader question is how long does it take them to accrue their hours, how long does it take for them to get their degree, of course, that's case by case, because some folks may have 2 to 4 years still. Oh, yes, thank you so much for bringing this up, Alma. If you see these resources on the side here, the 4th bullet down is a certification walkthrough deck that'll take you through that whole process. There's also links to those supervisor forms, so you can see what it looks like, essentially what the supervisor has to include and check off on as part of those hours verifications. Back to what I was saying before, in terms of the certification process and how long it takes for individuals to complete their degree or hours, that's very case by case.
So Ben, well, I've got you. The next question is also for you. How do wellness coach applicants going the experience route verify their hours?
The experience, I'm going to guess that means the workforce path. What they would do is they would work with their employer, and as part of the application process, they would have to download that form. They would record the number of hours that they're claiming on their application, and then a supervisor would have to sign off on those number of hours via that form. And that form then just gets uploaded into the certification portal as part of the application process. So in that walkthrough deck, it shows all of that and also has those forms. And it can be a combination too. So let's say you're at a new employer and you only accrued 100 or 200 hours. You can have one form for that employer, but say you have 1,000 hours from a previous employer that you just left. Those can combine together to make the minimum 1,350 hours for a certified wellness coach 1 or the 2,700 for a wellness coach 2. Yeah, if in that walkthrough deck there's any other questions, we have a great customer service team that can talk through eligibility, can talk through the process. So please reach out to us and we'll make sure that you get all the support you need to get whomever you need certified.
Absolutely. Thank you, Ben. Leah asks, for the CWC, our school was looking at getting this for our deans or admin who are not PPS credentialed or licensed. Would that work?
I'm not sure I fully understand the question. I'd encourage this individual to reach out to us. This is intended for undergraduates, specifically at the associate or bachelor's level, and meant to be kind of a new workforce for behavioral health, not specifically intended to be for administrators or for deans. But if I'm misunderstanding the question, please reach out. We've got an email that we'll list at the end of this. I want to make sure I get all the details and nuances so that I'm addressing that question properly.
Perfect. Thank you. Gina asks, can you go back and show the slides on ORP again, or the ORPs? And Amar, if you have anything to add on this one.
I wonder if they're looking for slide 32. Yeah, there we go. This is probably really useful. I'm sure our LEAs are thinking about other practitioners too, and if there needs to be an ORP on their claim. Definitely screenshot this.
All right. And Gina, if you have any other specific questions that you'd like, put it in the chat, or you can go ahead and email us. Matthew asks, what are the requirements for consent to treat for CWCs doing primarily pure Tier 1 activities?
So this is again kind of from DHCS. There are no specific requirements beyond what is already gathered when you're doing Tier 1 activities. And when you're saying Tier 1, I'm assuming you're talking about the MTSS, which are those universal screenings and universal prevention activities. But DHCS can also work with HCAI to develop a frequently asked questions potentially after this, and we can give you more information.
All right, thank you. Next question. If something is billed and not eligible for reimbursement, not meeting the time frame limits to bill, those claims will simply be denied for reimbursement, correct? Similar to LEA BOP, will they just be treated like tracking only?
So the way that I'm reading this is if something is billed to the CYBHI fee schedule and the date that it's billed is past 180 days, which is the time frame that you can submit a claim from 180 days after the date of service, those claims would be denied. I'm not sure exactly what tracking means, but yes, those claims would be denied if they're past 180 days and if they don't meet the good cause exemption, which a provider can request a good cause exemption if they have a circumstance that is eligible for that, and you can reach out to DHCS to learn more about those good cause exemptions.
Kenna, just in case they were meaning for the time frame limits, the 16 minutes, is there a specific response for that?
Oh, that's a good question. So if they were to bill for less than 16 minutes, it just needs to be documented. I mean, there isn't any way in the claim to know it was less than 16 minutes because that goes in the documentation. So if they were to bill for an amount of time that they didn't actually see the student, then we get into what's called fraud, waste, and abuse. And so it's just important to accurately document and to only submit claims for the amount of time that you rendered the service.
All right, thank you, Kenna. Next question from Jessica. Are observations, gathering information and understanding about a student's struggles before making intervention decisions a billable service?
Did we have a slide that listed out what the services that were listed in the state plan amendment are? Maybe we can go back to that.
Do you remember which slide number that was?
And I don't think we had.
I don't
Okay.
believe so, no.
Yeah.
Well, I'm going to post a link in the chat, which this is the state plan amendment. And in the state plan amendment, it lists out the types of services that, again, there's service components. So it can be one of these things, it can be multiple of these things that are all bundled up into one code. So I'm going to put what they are, and I'm going to do my best to make it look not ugly. But it's things such as wellness promotion education, care coordination, individual group behavioral health coaching, crisis referral. So all of these things are billable services for wellness coaches. And so, yes, you could, if an observation is a screening that is not requiring a licensed provider, that could be considered, I believe, a billable encounter.
All right, thank you. Mike asks, can wellness coach services be billable if they were delivered virtually?
Yes. I believe we have a slide on telehealth.
I think it just said face-to-face, but that also includes telehealth, correct?
Yeah, so telehealth, when it's face-to-face, that means that it's a video. If it was audio only, that would not be billable.
All right, great clarification there. Thank you. Deborah asks, how much supervision is needed?
So I'm guessing this is a question for us in terms of not ORP, but just making sure you're understanding around like how to support wellness coaches. We have general guidance on what we expect, but we really do look to the employers and those that are managing the wellness programs on campus, such as PPSC, to decide what is appropriate for supervision. It also depends on the number of coaches to the number of supervisors. There is an expectation for regular check-ins, as well as review and approval of services on a regular basis. That can be in small groups, that can be individual. So we really do look to our employers to validate and verify what is the appropriate amount of supervision. If there's any questions on that, we can also provide some sample models of what we have created in terms of what could be some guiding practices for supervision. We're happy to share that with you as well. We do have that included in our model deck.
All right, thank you, Ben. Alexandra asks, where do we put the T codes? We use SEIS and they need diagnosis codes like an F code or a Z code.
So the question is, where do we put the T codes? I'm trying to scroll through and.
Alexandra Garcia's question at 10:42 a.m.
We have so many that came in at that time. I'm scrolling.
Yes, yeah, it'll get you close.
When you're saying T code, I wonder if you're referring to the 0591T. So that's the CPT code. That's the service code. So the service code would go in the service code area, but it sounds like when you say SEIS, that's the Special Education Information System. That's also the San Joaquin County Office of Education's billing vendor. So they should be able to assist you in where to put your service codes on a claim.
All right, thank you, Kenna. Jennifer asks, can you clarify? I think we already clarified the supervision. Jennifer, if you still have any questions on supervision, go ahead and email us and we can provide further clarification on that. All right. Do you have any guidance on required note content for CWC notes to better prepare for audits?
HCAI, do you all have any guidance on documentation or care plans or how wellness coaches should approach that?
We haven't developed the specific documentation guidelines around that. We do have through the capacity grants team, I believe there is some templates that have been gathered on documentation that we could definitely look into and see if that can be shared out. That is amongst County Office of Education. So let me reach out to them to see if they have any templates, and if not, if there's any that can share amongst their cohorts. So we'll definitely follow up on that.
All right, thank you. Let's see. Adelie asks, is anything other than the DX code and CPT code needed for claim submission from a CWC?
So the DX code is the diagnosis code, and then the CPT code is that 0591T. They also need to have the ORP in the referring provider section, since there needs to be a licensed provider who's recommending the service. That would be, so the NPI of that ORP, and then the CWC also needs an NPI, and that would go in the rendering provider part of the claim.
All right, thank you, Kenna. Let's see. Next question. Jessica asks, what type of documentation other than billing is required and what is acceptable? I think, Ben, we hinted at this a little bit, but is there any other documentation that is required?
From HCAI's perspective, no, I'm not sure if DHCS has any requirements in terms of what must be documented for billing, but not from HCAI's perspective.
There are no specific documentation requirements for the CYBHI fee schedule program outside of what is already required per the licensing boards of those who might be supervising a CWC.
All right, thank you. Leslie asks, would it be possible in the future to allow for care coordination, especially with parents/caregivers when the student is not present? There are various scenarios where it may warrant a student not being present.
At least from the wellness coach model, a CWC can absolutely engage with the parent and as needed to help support the student. In terms of billing, I know that there's different requirements. So I'll see, from DHCS perspective, I'm sure that there's specific regulations around face-to-face and with the student present that might be a limitation, but I'll defer to DHCS for at least what the billing may entail.
We will include this in our follow-up notes with HCAI, just to ensure whether this can or cannot be performed if a student is not present.
All right. Great note. Thank you so much. All right. Rena asks, for MSW interns in their first year of internship with a bachelor's degree in psychology, when they register CWC certificate with 200 hours, would they be considered active to bill, or do they have to wait until they have all 400 hours?
Okay, I'm gonna go back and read that because that was a lot of details. Just one sec. I found it. Okay, MS interns in the first year of internship. Bachelor's degree in psychology. Register. I'm gonna encourage. It looks like Raina, reach out to us. I just want to make sure I'm fully understanding the nuances of what you're saying. But essentially, what I'm hearing is, as long as you are a CWC and you're performing services as a CWC. And again, if you're under that 400 hours, you're that registered designation of certification, but you still are CWC. You should be able to perform those services and still bill them. So my first thought is yes, but would be happy to connect with you more just to make sure we're understanding that you do have your certification, that you are performing certified wellness coach services. Those are the prerequisites to be able to get reimbursement for those.
Right, next question. Looks like we have some clarification on ORP requirements. Since it appears that wellness coaches provide prevention activities, I'm wondering why ORP confirmation that this is medically necessary would be needed, since every child could benefit from prevention.
So specifically, this is part of the state regulation that medical necessity is required. And specifically, it's just a service that is discovered by a screening, or excuse me, an illness or condition that's discovered by a screening, and that medical necessity means that whatever you're doing is to alleviate that disorder. When you're talking about maybe things prior to a screening, like prevention, DHCS is working to develop guidance around prevention and some of those universal screenings, and when they may not require a recommendation from a licensed practitioner. So we will work to develop that, but I'll just put in the chat the Welfare and Institution Code that talks about medical necessity.
All right, thank you, Kenna. Next question. The structure of the CWCs working in the wellness centers has been generally set to 15-minute periods for students to stay in the wellness center before either going to class or being referred. So based on that time frame, no service can be billed, correct? The minimum time frame is 16 minutes, which can be billed as a 30-minute service.
So that's something that we can take back to our benefits division. These were the codes that were selected for wellness coaches based on guidance when we were collaborating with HCAI. So we can take that back to see if these codes specifically can be billed at any less time than 16 minutes.
All right, thank you. Armando asks, let's see, if we have ASW and MSW interns in our system, can they bill under our system if they get certification as CWCs?
Yeah, I believe that was the same question or very similar question that I previously
Yeah,
answered.
that's right.
But yes, as long as they are certified as wellness coach, meet the requirements, and are performing services as a wellness coach, then yes, that should qualify.
All right. Next question, Elizabeth asks, do scales such as SSWQ, Ohio scale count as medical necessity, and what if they score low? If the score is low?
So that is a very nuanced question that I will need to take back, and we can respond to it in writing.
I think this would be a good question to email, and we can follow up with you on. All right, Laura asks, hello, we're a CWC education site providing the academic program through the social work program. The Student Health Center will be providing field study / clinical internship hours required for the CWC. Are we able to bill for the services the interns provide? Oh, same question. Interns are billable, yes, right?
Well, just to clarify, this is slightly different. If this is an institution of higher education, they are a qualified organization type for the fee schedule, but a requirement is that you must be within one of the fee schedule cohorts. I'll defer to Ken or someone else if there's any concerns about an IHE having people within their wellness centers and then billing for services as part of what they're doing to support their student population. My understanding is yes, that would qualify, but they would have to be enrolled in the fee schedule program.
I agree with that as well. So academic program supporting CWC education. If your academic institution is enrolled in the fee schedule, then you can bill the fee schedule.
And please, I didn't see who the question was from, but please reach out to us as well, and we can just chat through what that looks like and make sure that we're connecting all the information between HCAI and DHCS so that you understand, if you're not part of the fee schedule program, what the steps are, where you go to apply for future cohorts. I think that they're closed for this year, but there should be another, I believe, 2 cohorts per year is what I've heard DHCS say. Perfect. I'm seeing Ken and nod. So there are future opportunities if you're not.
Yeah. So that question was from Laura Hamilton. Laura, go ahead and email us.
Yeah, thanks, Laura.
Ben, do you want that at the Wellness Coach email?
Yeah, that's fine.
Perfect. And we'll have both email addresses that for DHCS and HK in the next slide here. There we go. Thank you, Alma. Yeah, so questions for DHCS, email dhcs.sbs@dhcs.ca.gov. And for HCAI questions, you can send it to wellnesscoach@hci.ca.gov. Thank you, Alma. All right, we're doing great on time so far, and we've been having great engagement. We really appreciate the questions that you all are bringing to us. Let's go to the next one. If the initial service is billed under CYBHI but is determined there would be an IEP, can the follow-up be filed same day under LEABO/SMAA for both medical private insurance?
So you cannot bill the same service to two separate programs. So you're going to have to decide which program to bill it to. If it's a completely separate service in the same day, you can bill to two different programs, but you can't bill the same service.
All right, thank you. Okay, let's see. Next question. The collection of student insurance information, even for Cohort 1 LEAs, remains a major hurdle for LEAs. What is CYBHI doing to assist LEAs in overcoming this difficulty?
Can you just repeat that question one more time?
Yeah. The collection of students' insurance information, even for Cohort 1 LEAs, remains a major hurdle for LEAs. What is CYBHI doing to assist LEAs in overcoming this difficulty?
So the collection of student health insurance is a requirement to be able to build the fee schedule as part of the application process to be accepted into the CYBHI fee schedule. Each LEA had to state that they had mechanisms for collecting student health insurance. And we also are very aware that there isn't a statewide portal of all commercial disability and medical insurance that exists. DHCS is working internally to identify ways that we can allow our participating LEAs and institutions of higher education to access Medi-Cal data. And then we're also working externally with our third-party administrator, Carolyn Behavioral Health, to access commercial data, but those things are ongoing. There isn't anything currently that is available to folks, but it is a requirement that was part of the application process for the CYBHI fee schedule.
All right, thank you, Kenna. Can wellness coaches bill for telehealth services if they are working with a parent and the student is not present?
So a two-part question. Yes, they can bill for telehealth, but we will, in writing, respond whether or not they can bill if a student is not present.
All right, thank you, Kenna. Can master's level staff who have their associates also be wellness coach certified and bill for both?
I'm not clear on what the bill for both part
Yeah.
is for. But again, while the intention is for undergraduate folks to get certified, if they do have a qualifying degree and have can sign up on their hours, they can get certified. And if they're providing CWC services, then those are billable. If we didn't answer the question or we need more clarity on what the billable for both part of the distinction between maybe a CWC1 versus a CWC2, I'm making some inference here, but please reach out if you want to clarify that question, and we can collaborate with DHCS if there's something that we can't answer.
Yeah, Elizabeth, go ahead and email us with more specifics there. All right, Casey asks, can you have two codes in one note, or does it have to be separate notes on different days?
It depends on what the two codes are. If someone is doing a group and an individual, those would be happening at different times. When you're talking about a note, I believe I am understanding it from a billing perspective that maybe you're talking about where you're documenting that for claims. And so if two things are occurring at different times, then they should be two different notes because they're two separate instances. And I think that's what you mean by the two codes. I'm assuming it's two different codes. But if you were, and this is for wellness coaches, so I am not going to get into codes for any other eligible practitioner type. But if you have other questions about other eligible practitioner types, you can reach out to DHCS as well.
All right, thank you. Okay, let's see. Next question. Here we are. I'm a little confused about the ORP. If the ORP is also a licensed marriage and family therapist and also sees students from, I'm assuming this independent therapy under CYBHI, can they still bill for services?
I'm also a little confused about this question, so this would be something good to reach out to DHCS. I'm not sure if they're asking if they can bill individually or if they can bill, if like a LEA can bill on behalf of them for their services. But if somebody is licensed, they do not require an ORP because an ORP is a licensed person who is saying, I am recommending this service for someone who's non-licensed, who the rendering provider is non-licensed. Also, just a reminder that ORP only applies to Medi-Cal. So private insurance does not require an ORP.
All right, great clarifications there. And Jennifer, if you still have more questions, go ahead and email DHCS with that. Elizabeth asks, what elements are required for an eligible care plan?
I think that might be an HCAI question.
Please reach out to us with more specifics. I think I'd have to understand a little bit more about what your request is. So if you can email wellnesscoach@hci.ca.gov, that would be great.
All right, Elizabeth, go ahead and email us there. Patrick asks, how far back can you retro bill for services?
So for the CYBHI fee schedule, services are not retroactively billable. They are billable up to 180 days after the date of service. So if you enrolled in the fee schedule, I'll say for cohort 5, which is our most recent cohort, their first date of service is January 1st of 2026. So you're able to begin delivering services on January 1st, 2026, and you have 180 days to submit that claim.
All right, thank you for those details. Will districts that are currently receiving LEA, BOP, and CRCS reimbursements for Medi-Cal eligible gen ed students have to move over to the fee schedule for billing?
So specifically, if you are billing LEA BOP and you are in the CYBHI fee schedule, for general education students who are receiving behavioral health services, so not pursuant to an IEP or an IFSP, you should be billing those students to the fee schedule. When you're in both programs, you absolutely should participate in both programs if you're in both, but LEA BOP should only be for students that have IEPs or IFSPs for mental health services. And if you have more questions, please reach out to DHCS.
All right, thank you, Kenna. Kara asks, in an earlier slide, it indicated both students with IEP or 504 not eligible for reimbursement. Our IEP students operate under a separate reimbursement program, but our 504 students are general education students. We can reimburse for face-to-face meetings with 504 students, or can we reimburse for face-to-face meetings with 504 students, including facilitation of 504 plan?
So DHCS has received this question in other venues and is researching, so we'll respond in writing.
All right, thank you. Let's see. Going back to the procedure code 0592T and the example of connecting a Medi-Cal student to CalFresh program and follows up to confirm enrollment, does this student have to have an initial prior to the follow-up? Most of the time it is assisting the parent sign up for government assistance, not the student.
So yes, that student should have an initial, and maybe that initial is identifying that the student needs CalFresh, and then the follow-up could be actually completing the application with the parent and potentially the student present, potentially not present, which DHCS will follow up in writing.
All right, thank you. Can districts blend and braid the capacity grant and wellness coach grant funding streams? Can districts utilize wellness coach grant funds to support rehired positions, i.e. staff who were hired to fill previously filled positions?
So it sounds like a blending and braiding of funds question. Go ahead and email us at wellnesscoach@hci.ca.gov, and we'll make sure to get you a response and loop in our grants team as well.
All right. Looks like we're still looking for some clarification on 0591T. Should it be used for assessments, but there's only limited to 2 per year? Is this correct? What if you do other assessments beyond the 2 limit?
Do we want to go back to the slide that shows the codes and their limitations? I believe it's closer to the beginning of the presentation.
12 or 13, I think.
And so the limit is specific to that provider providing those services for that student. When we talk about limitations in other Medi-Cal programs, limitations can be overridden with what's called a treatment authorization request. Those are not required for CYBHI fee schedule services. There is no prior authorization required. So if there's a need for more assessments, that's something that needs to be documented. But I believe, and it looks like we're not able to get the slide up on the screen, but I believe that the two limit is providing 2 a day, but you only need to do those initial assessments one time. So you shouldn't have to provide more than 2 units at one time twice a year for one individual provider.
All right, thank you. Let's see. We've observed that posted wellness coach positions reflect varied pay scales depending on the employer. Is there publicly available salary scale or guidance that districts can reference to ensure consistency and equity?
So HCAI, just based off of local control and unions and HR within school settings, we cannot dictate salary ranges, and so it's very contingent on region, size, et cetera, as well as type of organization. So we have some data that we are looking to collect on what employers are doing. We don't yet have that, and then we have provided some general benchmarks for our grant program, which is an up to amount of salaries plus benefits. So we're happy to share what that value was for the grant program. That was an up to salary amount, which with benefits included for wellness coaches. In terms of salaries, we know that they vary quite a bit from those in like Central Region compared to Bay Area, for example. So we unfortunately cannot provide salaries, but we can provide some guidance on where we landed with our grant program to help give some assessment on where a good general range might be.
All right, thank you, Ben. Let's see. If a student has 30 minutes in their IEP, can we bill insurance for the minutes served outside of those minutes?
I think this one might also be good to follow up in an email, but if you are seeing a student outside of their IEP, so the services are not pursuant to an IEP, then they should be billable.
All right, thank you. In regards to the slide regarding documentation requirements, mentions those under supervision need to have supervisor included. Does this mean that the CWC supervisor needs to sign off on all encounter notes similar to an MSW intern or ASWs?
I believe that's a question for DHCS.
So yes, But also supervision and how it works with HCAI is very specific. Supervision and how we're talking about for billing, it needs to be that if you're billing Medi-Cal, there's a licensed provider that's recommending the services. But do you have anything more specific HCAI around the supervision and what's required?
No requirements, except for that supervisor for employment must be either a PPSC or licensed clinician or school nurse on a school setting. Outside of school settings, it must be a licensed clinician. And then the expectation again is regular supervision and guidance. But we are not regulating how supervision must be documented and upheld. I think that I also saw a question around supervision within field experience. That is different. That can be a qualified field supervisor. It doesn't have to be one of those employer types. PPSC or licensed clinicians within the field experience. But if there's questions about education and signing off on those hours prior to getting certified, we can definitely dive into that more.
Thanks, Ben. Let's see. Please mention what kind of licensees should be supervising CWCs.
That would be, qualified behavioral health providers like a licensed clinical social work, licensed psychologist, licensed therapist, those that are within that realm of behavioral health.
Right. How should we bill for collateral services, for therapist type services? We provide psychoeducation and or planning support with teachers, since it sounds like collateral services can't be billed by CWCs because the student isn't present.
So that's correct. CWCs cannot bill collateral services. If you, I'm assuming, are a therapist providing other services, then there are other codes that you can bill on the fee schedule, and I can link our fee schedule scope of services document that has all of the codes and eligible practitioners listed on there. And then also, if you have more specific questions, please feel free to reach out to DHCS.
Thank you, Kenna. Is there a formal letter or written guidance available that specifies the general education students cannot bill through the LEA BOP?
So it isn't that they, and I'm not representing LEA BOP, so I will speak for the fee schedule. Only for LEAs that are participating in both programs, CYBHI and LEA BOP, they should be billing those non-IEP students to the fee schedule, and that's part of the provider participation agreement that you sign as a part of joining the fee schedule. If you are in LEA BOP and you are not in the fee schedule, you can still bill for all services that are provided to all students. But if you have other questions that are specific to that, please reach out to DHCS.
All right, for the scenario of the CWC providing in-class presentations on coping strategies, etc., is it required that it is medically necessary for each student?
Yes. To be able to bill for a student, medical necessity must be required, or must be established, excuse me.
Right. Can districts bill separately for wellness coaches that are not included on their reporting for grant funding?
Go ahead and reach out to the wellness coach or at hcai.ca.gov. We just want to make sure that we're properly assessing and addressing that question in terms of how to utilize the employer support grant funds in connection with the fee schedule program. Yeah, they just need to ensure there's not duplication or double dipping of funds. Then we'll have some guidance and also make sure to connect with DHCS on that.
All right, thank you, Ben. Steve asks, where do CWCs submit claims?
So if you're part of the CYBHI fee schedule, you are part of one of 5 cohorts, and part of that cohort process is an onboarding with the third-party administrator that's been contracted by DHCS, and they have an entire claims clearinghouse and education to be able to allow that. So you have to be part of the CYBHI fee schedule, one of the cohorts, to be able to bill for CWC services.
All right, thank you. We're coming to the end here. We're just going to take one or two more questions. Let's see. Make sure that there's a number of repeat questions. I'll try and scroll through as we're all right. Do minutes have to be concurrent to bill for health and well-being coaching for parent guardian? As an example, CWC calls parent to discuss mental health and housing resources. Parent then comes to school office later that day to meet with CWC to make a call to the agency. Can the total minutes be billed as a unit?
So I think that's a question that should be submitted to DHCS in writing so that we can, it's a really specific scenario that we can help to unpack.
All right.
So we've got our information here on the screen for folks, so please reach out to us.
Yeah, absolutely. All right. Well, we are pretty much out of time today. Thank you so much for your thoughtful questions and participation. If we didn't get to your question today or you think of one later, again, please email us. You can email DHCS at the dhcs.sbs@dhcs.ca.gov, and you can email HCAI at wellnesscoach@hci.ca.gov. We are standing by waiting to answer your questions. We recognize that this is an important part of this endeavor, and we want to make sure that you get the support that you need. We do appreciate you joining us today to learn more about the Certified Wellness Coach fee schedule. This program is not only important for wellness coaches, but it's an important part of HCAI's health workforce development efforts, and we're grateful for your engagement with us today. We would love for you to visit our website to explore the full range of HCAI resources, and we would also love for you to follow and engage with us on our social media platforms. In particular, as your wellness coaches are doing amazing work, please hashtag us with one of these. Let us know what great work that you're doing out there. We know that this program is making a difference in the lives of kids every day already, and we want to hear about it. And you can contact us at this phone number or the email address. Also, we would love for you to sign up for our newsletter. If you haven't already, please go to this address here, select any of the health workforce topics, and you'll get added to our monthly newsletter talking about all of our health workforce efforts. We would love for you to stay up to date with us. That concludes today's webinar. Thank you again for attending, and we hope you have a wonderful day.